Hey everybody, it's Kate. I'm doing a recording for Emergency Pharmacology so that I can make up that lost lecture. Thank you, Xfinity. So give a listen to it. Let me know if you have any questions and we'll move forward with those questions during lab. Okay? The primary objective for this presentation is for you to appreciate how pharmacology affects the human body and what the drugs that you can give as an advanced EMT are going to do to the patients that you're caring for. So the ability to develop a drug profile becomes the most important thing that you can do with regard to pharmacology. Other objectives include some of the different pharmacologic processes such as pharmacokinetics and pharmacodynamics, different theories of drug action, the drug-response relationship, factors that alter drug response, and predictable drug responses. We also want to consider adverse drug responses, and although they're not always predictable, we should be able to recognize that someone's having a drug response. We also want to talk about storing drugs. Fortunately, we don't have very many limitations with the advanced DMT drugs, and then talk about the drugs that we can administer by protocol. At the end of the day, as an advanced EMT, we want you to be able to defend every medication administration because you will be giving drugs offline by standing protocol based on your assessment. So what is the big deal here? The big deal is that you're being given an expanded scope of practice, and the advanced EMT is responsible for safe and therapeutic effective drug administration. It's your responsibility legally, morally, ethically for every drug that's administered. So it becomes critically important that you understand the indications and contraindications of all the drugs that are listed within your scope of practice. There's a number of different places that you can find out information about drugs. The World Wide Web certainly is easy to access from our smartphones. I'm pretty sure every rescue station has a big fat physician's desk reference somewhere in the back room. It's actually good for boosting kids at the kitchen table. Vermont EMS protocols have a listing of drugs in one of the appendices that will give you common information. I personally like the drug handbook. I think it's a good one to have either as an app or a book because it lists all drugs by name, gives you their classification, indications, contraindications, common dosages, and the mechanism of action. So what do drugs do in the body? How do they work? Well, a drug modifies existing tissue function. It can have multiple actions, also known as effects, and the action results from a physiochemical interaction between the drug and the functionally important molecule in the body. I listed nitroglycerin as an example here, and if you recall from EMT class, nitroglycerin is an indiscriminate vasodilator. That means that without regard for the location of the vessel, it dilates blood vessels to try to improve blood flow. So that's how it modifies that tissue function. The way that you administer a drug will have some impact on the effect of the drug on the target tissue. So the mode of administration, the way that you get it into the human body, affects the rate of absorption. The rate of absorption will then in turn affect the onset of action, and the onset of action is what affects the therapeutic response that we're looking for. Routes of administration can be further subclassified into two main categories, enteral and parenteral. The enteral category is drugs that are administered through the gastrointestinal tract, and I always remember E-enteral, E-eat, and that includes sublingual, which is what we've been doing with nitroglycerin, and oral, which is how we deliver aspirin. The parenteral routes of administration typically involve a poke, and so that's how I remember that, P-parenteral, P-poke. Subcutaneous injections, intramuscular injections for things like epinephrine 1 to 1,000 for anaphylaxis, and glucagon in the setting of hypoglycemia. Intravenous push, IV push, intranasal, intraosseous, which can be used for all drugs that are given intravenously. You can give them intraosseously, and then inhalational via nebs. The route of administration that you select will affect how quickly the blood is absorbed into the bloodstream and then transported to the target tissue. Obviously, if you're injecting a drug directly into the circulatory system via the intravenous or intraosseous route, that's going to be the fastest route of administration. You can see on this slide the more steps involved in between the route of administration and getting the drug into the circulatory system, the slower the absorption rate. Some drugs you want them to go slowly. You don't want them to be absorbed too quickly. There's a big difference between giving nitroglycerin sublingually versus nitroglycerin IV. So it does make a difference how you administer a drug. Mechanism of action refers to what the drug does to the body at the target tissue, whether it stimulates a response, blocks a response. What does the drug do? What's its mechanism of action? The therapeutic effect or the desired effect depends upon an appropriate concentration or dose of the drug reaching the target site. It might be a local effect, like if you put cortisone cream on some poison ivy on your skin, or a systemic effect where you give the drug and it has effects across the body. In order to see the therapeutic effects of the drug, you have to get the appropriate concentration or dose of the drug to the target tissue. Getting that concentration of drug to the target tissue is affected by three processes: the pharmaceutical process, the pharmacokinetic process, and the pharmacodynamic process. We're going to talk about each one of these in the next 3 slides. The pharmaceutical process is the drug getting into the body. I like to think about it like a pharmaceutical drug rep. What's the form of the drug that you deliver to the patient? Is it a compressed powder like the picture that you see here? That's a tablet that has to disintegrate from its original form to separate out the active drug and the inactive ingredients. And when you look at the pharmaceutical process, there's a lot of different ways that drugs can be packaged that will affect the rate of absorption. So for instance, there's different drugs that are extended release that are meant to dissolve slowly so that there's a more continuous distribution of the drug for a longer mechanism of action, or a longer duration, I should say. The second process for mechanism of action is pharmacokinetics. This is the movement of the drug throughout the body. There's 2 different aspects to pharmacokinetics that we'll talk about. We'll primarily be focused on absorption, but they include absorbing the drug into the body, distributing the blood to the target tissue, metabolizing the drug once the target tissue has been affected, and then excreting the remnants of that metabolite out of the body. For you all as advanced EMTs, when you think about pharmacokinetics, I want you to think about onset, peak, and duration. Those 2 things should go together always. Pharmacokinetics, onset, peak, and duration. Onset meaning how long does it take for that drug to be absorbed before you will see enough of a concentration at the target tissue to see a therapeutic effect. When will the peak of that effect occur, and how long will that therapeutic effect last? So pharmacokinetics for you is really focused on the onset of action, peak, and the duration of action of a drug. This slide just shows you a graphical representation of pharmacokinetics with regard to onset, peak, and duration. Cmax on the left axis there refers to the peak concentration, and then Tmax on the bottom axis there refers to the time it takes to get to that max concentration. And you can see the upswing of the absorption phase and then the slow elimination phase. The final process for mechanism of action that we want to discuss is pharmacodynamics. When you see the suffix dynamics, I'm sure you probably thought about change. So pharmacodynamics refers to how a drug will change tissue function. It's the study of the effects of the drugs on the body. It's specific to the concentration reaching the target tissue to get the resulting effect. Drugs will have a specific interaction with the target tissue at the level of the receptor, and receptors are like little receiver ports or antennas on the outside of the cell, and when a drug connects with a receptor site, it'll say do something or don't do something. So drugs that interact with a receptor that stimulate a response are called agonists. So albuterol is a bronchodilator, and it's an agonist, and it stimulates a response from target tissue. So if I told you that albuterol is a bronchodilator and it's an agonist, where do you think the target tissue is that albuterol stimulates? It's the smooth muscle that encircles the bronchioles. So that's albuterol, and that is a bronchodilator. Some drugs attach to a receptor to block a response, or they don't stimulate a response, and those are called antagonists. And the example within our scope of practice is naloxone. It prevents the effect of opioids by blocking the receptor site. There are very few drugs that will do both inhibition and stimulation of response, and we call those drugs partial agonists. One of the few examples that I'm able to find is, and I can't say this very easily, buprenorphine, and that is a drug that's used for opioid addiction, and it satisfies the physical need for the receptor stimulation but doesn't allow for the negative effects of the opioid, like overdose and death. Remember when we were talking about the human body and homeostasis, and we looked at the nervous system and the divisions of the peripheral nervous system that help us manage different things going on with our body that threaten homeostasis. And we were primarily concerned with the sympathetic nervous system that modulates our fight or flight response. There are specific receptor sites on cells that are sympathetic receptors. So when those are activated or stimulated, they will help get the body to that sympathetic dominant state. Things like increased heart rate, vasoconstriction, or increased peripheral vascular resistance to raise blood pressure, bronchodilation to increase tidal volume and allow for max oxygenation. There's two types of sympathetic receptors for you to know as advanced EMTs, alpha receptors and beta receptors. Alpha receptors are widespread in location throughout the body, and when they are stimulated, it leads to vasoconstriction, which increases systemic vascular resistance. And by squeezing down the pipes, you can raise the blood pressure by making the container smaller. There are two types of beta receptors, and the way that I remember them is beta 1, one heart, beta 2, two lungs, and that refers to their location. So beta 1 receptors, they're located in the heart, and stimulation of beta 1 receptors causes increased chronotropy, or increasing the heart rate, and increased inotropy, or stronger contraction, and that can help with the sympathetic response. The beta 2 receptors are located on the bronchial smooth muscle that encircle those bronchi, and when those receptors are stimulated, it causes bronchodilation. This is just a tabular representation of the location of the sympathetic receptor sites. You can see there the word adrenergic receptors. So sympathetic, adrenergic, sometimes you'll see those terms used interchangeably. Adrenergic, of course, refers to the adrenal glands that sit on top of the kidneys that we looked at, I think, last week in the human body. Sometimes there are patient-specific factors that may affect how a drug will respond. This is just a little list of some things that you might consider. Although the majority of our drugs that we're going to give as advanced DMTs, we are going to give those because of an emergency, and we really don't have to worry about too many of these for the drugs that we're giving. So age, pediatric versus geriatric, two very different age ranges there. Pediatric, of course, having such different sizes and weights that we have to be very careful with dosage. And then I'm sure you remember from EMT class some of the age-related changes in geriatric patients that might make the way a drug is processed in the body differently. Body mass can affect dosing, whether it's high or low. The time of administration, certainly you probably have heard, oh, you got to take an antibiotic on an empty stomach, or oh, you should take Motrin with a meal so you don't get an upset stomach. For us, we'll consider time of administration about when we're giving it with regard to what's happening with the patient. So if the patient isn't having chest pain, you can't give them nitro. If the patient isn't demonstrating that they're having bronchoconstriction as evidenced by wheezing, you can't give them a bronchodilator. The pathological state of the patient can make a difference too. If someone has liver disease or alcohol use disorder, they might not be able to process or metabolize a drug like Tylenol. So if you were to give someone with liver issues Tylenol on a regular basis, that might actually cause more liver damage. Genetic factors, there's certain genetic syndromes and disorders that prevent people from taking certain drugs. And pregnancy, of course, there are some drugs that will cross the placental barrier and could cause harm to a fetus. You're probably wondering why Chewbacca is on this picture. And I put Chewie on there because I thought, what if would Chewie possibly ever get poison ivy? And can you imagine trying to get calamine lotion on this dude? So that was a patient-specific factor for a topical drug. There you go. This is probably one of the most important slides in this entire presentation. The effect of a drug or the anticipated response is known as the therapeutic effect. So predictable responses include the therapeutic effect, the reason that you're giving the drug, but it also includes a side effect. So I'm going to use albuterol, the bronchodilator, as an example. So therapeutically, albuterol is going to relax the smooth muscle that encircles the bronchi by stimulating those beta-2 receptor sites. But a side effect is a little bit of alpha, so it can increase the heart rate. And so people will complain that their heart is racing or they're feeling like they're having palpitations. It's really, 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 really important that as an advanced EMT, giving people drugs that they may have never had, that you know what the therapeutic effects are, when you should expect the onset of effects, when those effects will peak, and how long the duration of the effects will be, and any side effects, so that if a patient says, oh, I feel like my heart's going to jump out of my chest, you can, with confidence and professional knowledge, you can say, oh, that's one of the side effects of albuterol. I'm sorry. Let's just have you take some nice, easy breaths. You're doing great. It's okay. Let me check your pulse. You're safe. All right. So that is a really, really super important thing to know about every single drug that's within your scope of practice. And if you don't know, it's important that you have a resource that you can look it up quickly. Unfortunately, there's going to be unpredictable adverse responses, and the one that is probably most dangerous to patients is anaphylaxis, or a severe over-allergic reaction. And because we're trained to give epinephrine 1 to 1,000 for anaphylaxis, we're trained to recognize or assess the signs and symptoms for that. So although I have not personally heard of too many patients, of any patients, having reactions to the drugs that we give, anaphylactic reactions, doesn't mean it might not happen. So the final effect response consideration that we have are drug-drug interactions. And it's really important for us to check to see if there's a drug interaction with something that we would be giving patients. There's really only one that we have to be super cognizant of, and that's giving nitroglycerin in the setting of any erectile dysfunction drugs like Viagra class drugs. That can cause a precipitous drop in blood pressure, and that's something that's from EMT class, so that's not new information. But what is new information is that you as an advanced EMT will be giving nitro to people that may not have ever had it before. So it's really, really, really important, and it's your responsibility to assess to see if they're taking a Viagra class drug. You probably recognize the 6 rights of drug administration from EMT class, making sure you have the right patient, the right medication, the right time, meaning you're giving it at the right time, the right dose, the right route, and then finally the right documentation. And documentation can include when you gave it, how you gave it, all of the 6 rights, or the 5 rights there. It's really important that you review the rights immediately prior to administration to prevent medication errors. A drug profile is an overview of a drug, what it is, how it's called, its name, and all of the information that you might need to know in order to safely administer a drug. Components of a drug profile include the generic name that's assigned by the U.S. government, the brand name that you might see, classification, meaning is it a blood pressure drug? Is it a drug for hypoglycemia or hyperglycemia? Is it a psychotropic drug? Is it a analgesic? So the classification is the general group of that the drug belongs to. Mechanism of action, how does it work? And pharmacokinetics, which as we recall is onset, peak, and duration. Other components of the drug profile include indications for use. When is it clinically indicated for you to give this drug? A clinical indication for albuterol would be difficulty breathing as evidenced by bronchoconstriction with wheezing. Contraindications, when should you not give this drug? Don't give nitro to a patient with a blood pressure less than 100. Side effects, what other clinical effects might you see when you give a drug? Maybe it's tachycardia with bronchodilators. Maybe it's a headache with nitro. How is it supplied? Is it supplied as a tablet? Is it supplied as a liquid for nebulizer, for nebulized inhalation? How does it come to you? What's the dose? And remember, the dose is in the amount of drug provided. All right, so if we look at this box of D50, there's 25 grams of D50 in 50 milliliters of fluid there. So if I told you to give a dose of 12.5 grams of dextrose 50%, you need to understand how much of that syringe to push in. And you can see to the right of that 25 grams, there's a little parenthetical statement that says there's 0.5 grams per milliliter. So if I told you to give a half a amp of D50, which is a crappy order, you'd be like, can you please clarify your order there, Kate? And I said, oh yeah, sure. Please give 25 grams of dextrose 50% IV push. You could look at the concentration 0.5 grams per milliliter, and then say, okay, if I want to give 12.5 grams, you could do a simple calculation and recognize that that's half an amp, and that's 25 milliliters. Special considerations are things like, well, make sure that you've verified that the patient is not taking a Viagra class drug, or that a drug is generally considered safe, like albuterol, and can be given in multiple doses in sequence. A couple years ago, the Food and Drug Administration changed the way that drugs are labeled, over-the-counter drugs are labeled, and so it actually resembles one of our drug profiles now, and it will have the active ingredient, indications, contraindications, side effects, all of that type of thing, storage, how to store it, that type of thing. So it's kind of interesting if you start reading the backs of drug containers to see what the drug profile is. As we progress through the course, we would like for you to be able to develop a drug profile for each of the drugs that's within your scope of practice as a Vermont Advanced EMT.